If your baby is crying more than usual and grabs his ear, he may have an ear infection, which is inflammation of the middle ear. Ear infections are the most common reason parents take their children to see their doctor. Although usually not dangerous, ear infections can be very painful and disruptive to a young child's life. Fortunately, there are treatments and measures that can be taken at home to prevent ear infections in babies. Why are ear infections so common in babies? Babies are more likely to get ear infections than adults because their immune systems are still developing, making it harder for them to fight off infections. Young babies are also the most vulnerable because they have smaller, softer and shallower eustachian tubes than adults, making it harder for fluid to drain from the ear. Eustachian tube connects the upper part of the throat to the middle ear. If the eustachian tube is inflamed or blocked with mucus due to a respiratory illness such as a cold, fluid cannot drain. The most common ear infection is called acute otitis media, where parts of the middle ear become infected and swollen and fluid gets trapped behind the eardrum. Ear infection symptoms in babies: fever, pain in the ear, irritability or fussiness, rubbing and tugging the ear, difficulty in sleeping. Can you prevent ear infections in babies? The best ways to prevent ear infections in babies is to reduce the risk factors associated with them. Here are things you can do to reduce your baby risk for ear infections. 1. Vaccinate your child. Make sure your child has taken all the required doses of vaccines. Studies show that vaccinated children have fewer ear infections. The pneumococcal vaccine protects against Streptococcus pneumonia, a common cause of middle ear infections. The flu vaccine can also help prevent ear infections. 2. Breastfeed. Breastfeed your baby. Breast milk contains antibodies that can help protect your baby against various illnesses, including ear infections. The American Academy of Pediatrics recommends breastfeeding your baby exclusively for the first 6 months and can be continued for as long as both mother and baby desire it. 3. Avoid bottles in bed. Avoid bottle feeding when your baby is lying down. Milk can pool in their throats and enter the eustachian tubes, creating a medium for bacterial growth. 4. Avoid smoke exposure. Do not smoke. Smoking is associated with an increased incidence of ear infections. Possible explanations include smoke-induced inflammation of the eustachian tubes and reduced effectiveness of our ears, built-in mucus-clearing mechanisms, in the presence of smoke. Remember not to allow smoking inside your home or near children, or in your car. Make sure your children's daycares are smoke-free zones. 5. Decrease pacifier use. Pacifiers are associated with an increased incidence of ear infections. Sucking may inhibit proper eustachian tube function. The American Academy of Pediatrics and the American Academy of Family Physicians recommend weaning babies from pacifiers in the second 6 months of life to prevent middle ear infections. 6. Wash your hands. Children and adults who wash their hands with soap and clean running water can help prevent the spread of germs, which can cause colds and ear infections. Hand washing is important, especially after using the bathroom, when preparing food, before eating, and after coughing, sneezing, or blowing your nose. 7. Switch your child to a smaller daycare center. Children in daycare center are exposed to more upper respiratory viruses, making them more at risk of ear infections. When to seek medical care. If you are concerned that your child has an ear infection, be sure to see your child's pediatrician. See your doctor if your child has a fever of 102.2 degrees Fahrenheit or higher, pus discharge, or fluid coming from the ear. Worsening symptoms. Symptoms of a middle ear infection that last for more than 2 to 3 days. Hearing loss. Despite your best efforts to prevent them, your kids may still develop recurrent ear infections. If that's the case, he or she may need to be evaluated by an ear, nose and throat specialist. Your doctor can check for an ear infection by looking inside your child's ear and checking if there is pus in the middle ear. Sometimes antibiotics, such as amoxicillin, are needed to treat severe cases right away or cases that last longer than 2 to 3 days. For mild cases of middle ear infection, your doctor might recommend watchful waiting to see if antibiotics are needed, or delayed antibiotic prescribing, where the prescription is given with the suggestion to wait 2 to 3 days to fill it.